So good afternoon. Again, I'm Paul Bolin. Just wanted to express some gratitude to the Maine National Guard for doing the flyovers on Tuesday of this week for several of the hospitals and health centers throughout the state. It was a very heartwarming gesture of support to healthcare workers throughout the state, and it was something that certainly was well received by our staff and visitors alike. So wanted to thank for that. Also wanted to note we're starting this discussion today wearing masks to show support and to stress the importance of masking when in situations where you can't socially distance appropriately from other people. Dr. Jarvis and I today are sitting relatively far apart from one another, and so we'll be removing our masks throughout the rest of the discussion so that you can have better audio from us. But wanted to start out the meeting to show and reinforce the importance of masking in the community, and certainly masking within our facilities, which is a requirement to protect patients, staff, and visitors. Dr. Jarvis?
Thank you, Paul. I did want to point out that these masks were designed and manufactured between our collaboration of Northern Light Health and a company called Intention out in Herman, and so we are thankful that we have such creative people here in the state of Maine who have assisted us. As Paul said, we're going to take our masks off in order to assist in our audio, and I'm going to put mine in my paper bag so that it can dry out overnight. I will say that while we are encouraging the usage of face coverings, it does not necessarily need to be a mask. Certainly other face coverings are appropriate. Cloth masks, scarves, bandanas, or other kinds of coverings that can help cover your mouth and nose to help prevent the spread of disease. I'll start off with a few numerical updates. Currently, Northern Light Health across its entities are caring for 9 patients who are positive for COVID-19. One of them is at Eastern Maine Medical Center. 3 are with our home care and hospice and being taken care of at home. And then the additional 5 are down at Mercy Hospital down in Portland. Since mid-March, Northern Light Health has cared for approximately 157 patients positive for COVID-19. And we have performed 6,654 tests for COVID, with 193 of those being positive. Testing has certainly been in the news a lot lately, both on the local and the federal level, and we have expanded out testing at the state level and here at Northern Light Lab. And so people are just kind of wondering, what is it that we're going to do as we have that increased capacity? We continue to focus in on those same categories that we had talked about since the beginning of this pandemic, that we need to test those individuals who are critically ill and need to seek hospitalization, symptomatic healthcare workers and first responders and other frontline officials, symptomatic people living in congregate living situations such as long-term care facilities, nursing homes, shelters, and the like. And then we need to screen some individuals who present where being positive may change the course of the treatment of their disease. So patients presenting to the emergency department with symptoms where having a positive test may result in needing to be admitted. And then other individuals where either their symptoms, their clinical condition, or procedures that they need to have done, it would be beneficial for us to have had a test in the last 24 hours. But we've expanded that out. We are now testing some other individuals, particularly those individuals who may need to undergo a time-sensitive procedure or diagnostic test at one of our facilities. And we're doing that in order to, one, make sure that we are safely caring for that particular individual, but also for our healthcare workers, and making sure that if a patient was positive, that we wear the appropriate personal protective equipment to protect our staff so that we can stay safe and healthy in order to take care of you. And then we may start seeing that we will expand out to take care of other symptomatic patients who do not fall into those other categories that I spoke about. In the coming weeks, as both the state lab and Northern Light Lab increase their capabilities, we may be able to expand that testing out to test those individuals who before as outpatients have not been tested, particularly those over the age of 60 and those with chronic medical conditions. and at some point we hope to be able to test any individual who is exhibiting symptoms of COVID-19. We think this is important both from a clinical standpoint in helping to address that particular patient, but also from a community standpoint to know the exact amount of spread that we're seeing across our community. And there may be other updates as we go along regarding that. Lastly, I did want to talk a little bit about one of the things that has been out in the media for the last week or so, and that was about vitamin D deficiency and its effects on individuals who are infected with COVID-19. What has been found is that those people with a severe vitamin D deficiency, which is relatively rare in the United States, that those individuals have had a more severe illness from COVID-19. This does not seem to be true even for people who have low vitamin D, who may even be taking supplements on their doctor's orders. And so it's just one of those things that are out there that we felt we needed to address. And with that, we'll open it up to questions.
Okay, as Dr. Jarvis mentioned, now it's time for questions. I'll call on each media organization to unmute, and you'll have a chance to ask 2 questions and direct your question to Paul or Dr. Jarvis, or if you're not sure who is the best person to answer your question, just ask it, and Paul and Dr. Jarvis will decide.
And we'll try to repeat I'm sorry, I didn't mean to cut you off there, Andy. We'll try to repeat the question, but if we forget to, or if you all can't hear what the question was, please just ask us.
The order of questions today will be Ellsworth American, Orland Press Herald, WABI, WERU, News Center, TV7. With that, Kate Koff from Ellsworth American, you're up first.
All right. Thank you very much to both of you for doing this. So my first question, probably directed at Mr. Bolin. I'm wondering if you can give us an idea of the cost to treat a COVID-19 patient at one of your hospitals. And then my second question is, I would love to hear a good layperson's explanation of the base rate fallacy and how it might impact the success, basically, of antibody testing. Those are my questions.
Sure. Well, let me take the first one, and I'm going to ask you to repeat your second question. I was having trouble hearing what you said. So, what was your first question?
So my first question was, can you give us an idea of the cost to treat a COVID-19 patient at one of your hospitals?
Sure. So the cost to treat a COVID-19 patient varies widely based upon the symptoms exhibited and the severity of the illness in the individual. Treating someone could range anywhere from testing and primary care correspondence and visits through inpatient hospitalization or even in an ICU setting. So there is a wide variety. I'm sure that there's somewhere a national average of the cost, but it certainly varies widely from primary care appointment fees to much more extensive hospitalization and other comorbidities and other variables that would impact the patient's stay and treatment.
Okay, thank you.
And what was your second question?
My second question, so I've been reading about the base rate fallacy and how it impacts basically how useful antibody tests are. And I was wondering if somebody might be able to give me a good kind of layperson's explanation of that.
Sure. I'm actually going to direct that to Dr. Jarvis because he really is the expert on that piece.
Yeah, I won't say I'm the expert on those specific the terms that you use there, but I will kind of explain where the difficulty is when it comes around serology testing or blood testing, whether that be for antibodies, which is the protein that the human body makes to fight against other things, or antigen, which is the protein of whatever it is that's infecting the body. And so they work hand in hand. And there are tests to determine both of those, the level of antigen and the level of antibody. The limitations of these tests are we're not exactly sure what the clinical relevance is when we get one back. So I'll talk about the antibody test first. There are 2 major antibodies that the human body has to respond to infections. One of them is IgG, and that is the one that lasts long term. And it's when we get vaccinations as kids, it's the one that continues to protect us years later. The other is IgM, and IgM is what your body produces when there is an acute infection. With every kind of infection, the rate that both the IgG and IgM antibodies increases is different. and the length of time that IgM antibody stays elevated is different for each type of infection. And right now we just don't know enough about how COVID-19 and the body's response to COVID-19 changes those numbers to say how long somebody who has a positive IgM antibody test, does that mean that they have the disease now? Does that mean that they had the disease last week? Does that mean that they had the disease back in February? Similarly, the level of IgG, all it tells us is that the patient had COVID-19 at one point. The problem is that COVID-19 is a coronavirus, and human beings are infected with coronavirus on a regular basis. And so some of the limitations we have is that the COVID-19 antibody test may be picking up coronavirus infection from when you were infected with a cold or something else that coronaviruses cause. So that's where the limitations come in. And with every test, there's always limitations because no test is 100% perfect. We have to kind of look at other things. What's the prevalence of the disease in the community? What's the likelihood this particular patient has the disease? Which is why all along we've been talking about testing symptomatic patients and very rarely testing asymptomatic patients. So probably a little bit more technical than you wanted, but maybe not quite as technical as other people have said. Thank you.
Thank you.
You've always asked the best questions, Kate, so thank you.
All right, next we have Portland Press Herald, Joe Lawler, you're up.
Yes, hi, thanks again for doing this. My question is about remdesivir and just what has been your allocation from the state? How do you anticipate using it with patients, and where does it fit in kind of the toolbox of treatments, things you can use to help with COVID-19?
Great. So the question was about remdesivir. Remdesivir is an antiviral medication that was being developed for another use, and the company Gilead decided to do trials to see if it was effective against COVID-19. Right now, there is limited data out there, and I know I continue to say words like that, but that's the way things are with COVID-19. It has not been around long enough for us to know a lot about it. But the limited data that we have showed that remdesivir has been helpful. It has been helpful in two separate groups of people: those who have been who are critically ill and on ventilator support, and those who are presenting with some moderate to severe symptoms before they need ventilation to help try to prevent them from needing to go on a ventilator. Unfortunately, it is not shown to decrease the number of deaths as of yet. Maybe we will be able to show that, but right now we have not. So the company that makes that particular medication has donated the medication to the federal government, who has then dispensed it out to the states. And yes, the state of Maine did receive a very limited supply of remdesivir and did pass that on to certain health facilities, including Northern Light Eastern Maine Medical Center. We did that as a collaboration across the state and with an agreement that we would use the medication in a fashion that was good for all of our state and not just particular areas. Currently, as we speak, we are coming up with unified guidance for use for this medication and which patients it would be particularly helpful in. Again, some of that is because of its limited supply, and some of it's because of the limited knowledge. We are hopeful that we will continue to receive additional shipments, but that is never guaranteed. It is part of the supply chain like anything else. And so currently, yes, indeed, we do have a supply. It is very limited and will be used on a case-by-case basis with our medical experts determining whether it's clinically advantageous for a patient to use it. So thank you for that question.
Bill, do you have a follow-up question?
Well, I mean, I know that you're still coming up with guidance, and it's case by case, it like you were saying, but can you kind of give us like at least somewhat of a general idea of what types of patients will be receiving this, and kind of some general guidance on that?
So general guidance would be that this would be patients who are sick enough to be hospitalized. So it would not be used currently for any individual who is ambulatory and could remain at home or remain in a nursing home or something along those lines. And so it would be patients who are hospitalized. Beyond that, it's going to be difficult for me to specify exactly which patients would qualify and which would not, simply because, again, those are being developed as we speak.
Okay, next we have Emily Tadlock, WAVI.
Hi, Dr. Jarvis. I have two questions. One of them might be a little twofold, so I'll just start with the first one. With things beginning to reopen across the state, what are some ways that folks can be responsible consumers?
Emily, thank you for that question. That is a tremendously important one. And so the question was how, as we start to reopen various parts of the economy, including healthcare, and starting to get back into some of those procedures and visits that have been delayed, how can people act responsibly? First and foremost, we need to continue to do all the things that we have talked about since February. We need to practice social distancing. We need to stay at least 6 feet away from each other as much as we can. We still need to stay home if we don't have a need to go out. This is not the time to go and start exploring parts of your community that you haven't been out and seen in a while. We need to wear face coverings when we are out in public. It is important that we do that. When you wear a face covering, you are not only saying to people, hey, I find this important, but you are protecting the other people in our community. And as they wear their face covering, they are protecting you. And that's the important thing, because we do know that there are patients who are asymptomatic or pre-symptomatic who are shedding virus and can infect other individuals, and face coverings helps to prevent that from happening. We need to practice good hand hygiene and washing our hands on a regular basis, using hand sanitizers when we should. We need to listen to the businesses when we approach their doors. If they say you must wear a face covering to enter our facility, wear a face covering when you enter their facility. Just like when they ask you to wear shoes and shirts, do the same thing for face coverings. It's very important. And then when we are out and about and we are at our businesses and industries and the like, make sure that you're compassionate to other people. Stay that 6 feet away, even if that means you need to step to the side of the aisle so the other person passes by. Particularly when you see individuals that may be more vulnerable, people who appear to be over the age of 60 or have other health conditions, we need to be cognizant of that, and we need to protect them. And if we do that, we will reopen our entire economy much sooner and in a much safer way, and we will all be better for it. The reason why the numbers that we have reported of admissions and deaths from COVID-19 in the state of Maine are low compared to what we predicted back in February is because we listened to this advice and followed it, and we need to continue to do so even as we reopen parts of our economy. So thank you for that question.
Okay, and then my second one is, what, if anything, is Northern Light Health doing to prepare for if we begin to see cases of this pediatric multi-symptom inflammatory syndrome in children, and how worried should our parents be?
Yeah, another great question. And again, so the question was, is this new syndrome that we're seeing around in other states, particularly in New York, of children who are having severe illnesses that we believe is secondary to COVID-19 infection. What are we doing to prepare for that, and should we be worried about it? But this is yet another reason why we all have to protect ourselves and protect other people. None of us would feel good if we went out without a face covering, we didn't realize we were infected, we infected a small child, that child then turns sick or winds up with this severe disease and then has complications due to that. The only way we can know we're safe is to protect each other. So what is Northern Light doing? We are well aware of this syndrome. Our pediatricians have all been versed on it, and particularly our pediatric hospitalists, or those pediatric doctors who take care of our patients within the hospital, have all been briefed on the symptoms to look for, and then what we need to do to prepare for that. I won't get into specifics because it'll be a little bit complex, but I will tell you that we are well aware of that, and the state of Maine has done a great job of continuing to update us when they get more information.
Okay, up next is Amy Brown, WERU. Amy, the floor is yours.
Thank you. Dr. Jarvis, I just have one question. I spoke with a pharmacist yesterday who said that they're now experiencing shortage of Famotidine, the prescription strength of the Pepcid AC, just following on the heels of hydroxychloroquine just got mentioned in the media by someone, and now it's really hard for the patients who actually need it, who are already prescribed it, to find. It's even sold out in a lot of the over-the-counter places where you can buy it. So, and there's no, I think there was some anecdotal mentions in Italy, I believe, that some of the patients who were taking the Famotidine before they got sick seemed to fare better than other patients. So that wasn't borne out as a causal effect. There hadn't been any research, but someone mentioned that, and now the pharmacist can't get it anymore. And I imagine that we'll see more of this. Is there any way to prevent, someone has to be writing prescriptions for it all of a sudden when something gets mentioned in the news? I mean, the patients with lupus who needed to take the hydroxychloroquine were at risk of not being able to get it because someone was writing out prescriptions for it to other people who had heard the news. Is there some way within first off, are you experiencing any shortages through the Northern Light system? And secondly, is there anything that can be done to monitor that within the medical community?
So that's a great question, and the question was really about is there now a shortage of famotidine, particularly due to the fact that it was mentioned as that possibly patients who had been taking it as part of their treatment for heartburn or esophageal reflux, that they fared better when they received COVID. And as you said, that's anecdotal evidence. Again, nothing that's gone through rigorous trials to prove that. There was already a limited supply simply because ranitidine, which is yet another medication that helps prevent the production of acid in our stomachs, had been recalled by the FDA. And so I think some of the shortage is a combination of those patients who had been on ranitidine before and being transferred over to famotidine. And so I think that contributed to it. I would not doubt that there probably is some prescribing going on. I have not heard that has been a problem at Northern Light Pharmacy. And if we do find that out, I will certainly have that passed on to you guys. It is something that we do need to consider. You are correct with the hydroxychloroquine. We did have to monitor prescriptions initially when those reports came out in order to make sure that we can continue to have that medication for those people who needed it for their chronic illnesses. Thankfully, that was not a major issue for us, and I hope that this will not be a major issue for us as well. I will point out that famotidine is an over-the-counter medication as well, so we can't prevent individuals from purchasing over-the-counter medications like we can monitor for prescription medications. Thank you for that question.
All right, next up we have News Center Maine. Dana Rosengard, do you have a question today?
I sure do. Good afternoon, everybody. Dr. Jarvis, we get COVID numbers from you and, of course, from the state's CDC every day. I'm curious to know which number or statistic do you see as most important or telling and why?
That is an excellent question. I would say that the two that I look at most greatly are hospitalizations across the state and then hospitalizations per county. The county one's a little bit iffy because many of these individuals need to be transported to one of our larger tertiary care facilities, in which case they may not be in the county that they actually either contracted the disease or where they live. But I think those are the ones that are the most concerning to me because that gives us a great indication of the severity of the illness in our communities. And so it's what I watch every day. I do watch the overall number of positive cases, but we know that that's a false number because we know we are not testing everybody, not even everybody with symptoms as of yet. The other one I watch is the outbreaks that we see not only in our long-term care facilities, but we've had a few outbreaks in some smaller community settings as well. And the reason why those are important for us to watch is because in all likelihood that infection came from outside, somebody coming into the facility, and then it spreads very, very quickly. And it's important for us to monitor that because as we reopen our economy, we are going to be tempted to start having gatherings that are larger than 10. And when that happens, then it's very easy for one individual to spread that disease to many individuals, and then we're back where we were when this pandemic started. So those are the things that I look at, and I really look at it in that phase. First, our hospitalizations. Second, the overall number of cases, and then lastly, where those cases are located. Thank you for that question.
Okay, and the second question, based on what you just said, testing everybody. When do you see that as something that can actually happen?
So I don't think we'll ever get to a point where we can test everybody. When you do the math, if the state of Maine were able to do 100,000 tests a week, it would take 13 weeks for us to get through just the citizens of Maine testing them once. Even if we were at 10,000 tests per week, it would take 2.5 years to accomplish that. And so that's where the concern is when we talk about the number of tests that are available. So right now, we really do need to focus in on those individuals who would benefit most from knowing whether or not they were positive, and then looking at particular settings, long-term care facilities and the like. I will say that we are getting to a point where we can test more individuals, and we may get to a point where we can test more out in the community to get a general sense of the prevalence of the disease or how many people are carrying the disease. But unfortunately, it will be a while before we ever get to a point where we can test everybody, because there's just the capabilities of doing that are very difficult.
Thank you.
All right, and finally 7, Fox 22. TJ Trimble, you're up.
Good afternoon, thank you. Good afternoon, Dr. Jarvis, how are you?
I'm good, TJ. How are you?
Not too bad. I'm not sure if this question is for you or for Mr. Blewett, but I'm wondering now that some of the elective procedures, surgeries and testing have been restarted, how close to being back to pre-COVID numbers are you?
Paul, would you like to take that?
Sure. So the
Does that
question,
make any sense?
it did. Yes, thanks.
Okay.
So the question being, how close to pre-COVID numbers are we in terms of patient care? I don't have the exact number of that right now. I know that we are opening in a phased approach various procedures. We are seeing a slow uptick in appropriate emergency department and other access to patient care, which is very appropriate. We want to make sure if people need to be seen that they come in and be seen. We are open. Healthcare throughout the state is open, and we want to make sure that people aren't foregoing important and urgent medical care because of fear of COVID-19. But we have not, at this point, reached a level of patient care that would have been our pre-COVID numbers per se. But we are continuing to see improvements in patient flow and services throughout Northern Light Health. Dr. Jarvis had a couple of comments as well.
Yeah, I just want to say that as we do this, we want to reassure people that we are taking every effort to maintain the safety and security of our patients, visitors, families, and our staff. So you will continue to see that we will be wearing masks when you enter into our facility. You may see us wearing even more protective equipment than just the mask, wearing gowns, gloves, and maybe even face shields or complete hood coverings, depending on what's available as far as the PPE goes and what level of concern we have for the particular individuals. We will continue to ask screening questions at our door to make sure that people do not have symptoms, and if they do, that they are treated and managed appropriately. And we will continue to limit visitation as hard as that is. And as a family physician, I know the importance of family and I know the importance of closeness, but right now it is important that we keep everybody safe, and we want to say that we are doing that. In addition, at our practices, you will see the exact same experience. So even when you go to one of our ambulatory practices, you will have to go through a screening process. You will see us wearing masks, and we again require you to wear face coverings when you come to our facilities, whether that be at the hospital or one of our outpatient practices. And again, all of that is done to be safe. You will probably also notice that we are more overtly cleaning things in front of you. We have always done a good job of keeping people safe and keeping our place sanitized, but we're going to be showing you that we're doing that a little bit more often, just so that you can get that sense of security. We want you to feel safe and comfortable when you come to our facility if you need our facility, because if you need our facility, you need to come to see us.
Thank you, gentlemen.
Thank you.
Thank you.
All right, well, that concludes our Northern Light Health COVID-19 update for today. As I mentioned earlier, we'll have the clean audio and video file. We'll send that over to you probably in about an hour. Moving forward, we're going to try to do these every Wednesday. It looks like there may be exceptions, but you can look for an invitation to the next one Wednesday morning of next week. As always, we thank you for helping us spread the word and get the good information out there. And if anyone has any follow-up questions, just let me know. Thanks, and have a good Friday.
Thank you, everybody.
Thank you.
Great.